Hello, this is Dr. Ford Brewer with state-of-the-art heart attack and stroke prevention, access for all. I had a patient come in to me last week with a CT report saying multiple pulmonary nodules. That's not uncommon. We usually get single pulmonary nodules, but multiple can happen as well. And as you can guess, the patients are very concerned and very worried. This can happen after just chest x-ray for other medical reasons, or it can happen often with a coronary artery calcium scan. Obviously, the patient's worried about cancer. Now, this patient had looked some things up on Google, and the first thing they found was a statement that the most common cause of multiple pulmonary nodules is a cancer. So this patient was obviously very concerned. However, here's the twist. The radiologist's report said the recommendation is to review this after 12 months if the patient is at low risk, or to repeat it at 6 months and again 18 months if the patient is at high risk. So obviously this radiologist was not thinking cancer. Why is that? Well, there were several reasons. First was the size. With the exception of one nodule, all of these nodules were less than 5 millimeters in size. The one exception was 5.1 millimeters in size. In some radiology standards, if the nodule is less than 4 millimeters in size, they say there's zero possibility of cancer. There's never zero possibility of anything, but that gives you a little bit of standard for looking at what we look at. Another quote here, another reason why this radiologist did not think this was a malignancy or a cancer was, quote, biapical pleural parenchymal opacity, most likely scarring, end quote. What that means is this patient had some scarring. We often see scarring in the tops of the lungs, very much associated with aging. Another quote from the report, the lungs are otherwise clear. So there's no evidence of a tumor anywhere else. No evidence that there is a primary tumor and that these are metastases. There's no fibrous diseases such as borreliosis. There's no evidence of tuberculosis in the lung. Okay, so you begin to get some of the pictures, some of the things that we look at. Item number 4, there is no effusion. An effusion is simply a pooling of liquid in the lung area that should not be there. Again, an effusion would be a sign, a potential sign of cancer, but there was none. Number 5, quote, mild linear scarring or thickening along the sulcus, end quote. Again, a thick scarring or other types of scarring might be a little bit more concerned, but this radiologist said, look, this is a thickening. We often see that. So just to run through a few things in terms of images. One image that you can see is the shape. This is called a corona shape or a stellate or star shape. That indicates scarring going out into the rest of the lung tissue. That's a bad sign for potential cancer. That was not in this CT, by the way. Again, a statement about the sizes. The smaller nodules have little or no probability of becoming of being malignant. One of the final comments, and again, this is some information from a radiology standards group. We also look at calcification patterns. So there are a lot of things that we can look at. But guess what? The patient has at least a few days, usually a few weeks, sometimes a couple of months, being nervous. Most of these patients, by the time they come back around at 6 to 18 months, 12 months, for repeats, have often forgotten it. So thank you again. Subscribe to my YouTube channel for state-of-the-art cardiovascular disease prevention for all.